New BA.2 coronavirus subvariant is now the dominant strain of the virus here in the United States. To talk about that, Dr. Bill Hartman, principal investigator for the UW Health pediatric Moderna vaccine trial that's moving right along. Dr. Hartman, let's talk about BA.2. It made up more than half the cases in the U.S. last week, and according to the U.S. the Centers for Disease Control, that was their latest data. Remind us again, what is BA.2? What is a subvariant? This is of Omicron, right?
Right. So this is a variant of the Omicron variant. So that's why they call it a subvariant. There's a few mutations here that make it slightly different than the original Omicron, if you will, which actually has made BA.2 somewhere between 60 and 80% more contagious. But they do feel that if you have had Omicron COVID before, that you're going to have pretty good immunity versus this subvariant as well.
This is the subvariant causing lockdowns in other parts of the world, right? We just had video out of Shanghai, empty streets over there. What's the difference for here in Wisconsin? Because we haven't seen a real uptick in cases.
So in the U.S., actually, this BA.2 variant has been around for some time, and it's just now starting to take off, and we'll probably see a small spike in cases, but I don't think we'll see a surge, probably because, as Dr. Walensky said from the CDC yesterday, the U.S. in general has probably about 95% of the population that has some sort of immunization against COVID at this point, whether it be through vaccinations plus COVID, or a previous infection with COVID. And so because we have such high community immunity, hopefully we can keep the number of cases from BA.2 down.
Yeah, not a lot of people left. That's an incredible number, 95%. All right, doctor, let's talk ivermectin, the drug often used to treat parasites. That's been a hot button issue, as some believed using it could help in the recovery of COVID-19. I mean, this was pushed by some Republican lawmakers. We know Aaron Rodgers was taking it. And all of this time, doctor, there was a large-scale clinical trial of the drug happening behind the scenes, and the results are out. Researchers say ivermectin is a dud?
Right, and so there was some interest around ivermectin, especially early on, because there was some cell data from the lab that showed ivermectin having some effectiveness against COVID-19. But as they moved into clinical trials and this large randomized controlled clinical trial in Brazil and Canada, they found that ivermectin really had no effect at all on hospitalization, on progression of disease, on the level of virus in your body after a week, on symptoms. It really turned out to be nothing more than a dud. It's kind of like playing tennis with a golf club. Anecdotally, once in a while you may hit the ball, but overall the golf club isn't made to play tennis. And the same could be said for ivermectin. It's not made, it's an anti-parasite drug. It's not made to fight viruses.
And I know doctors are probably so concerned about what happens if you take it and you don't need it. There are some serious side effects that can happen from taking it, right?
There are, but it is an effective drug against parasites such as scabies, things like that. But against COVID-19, and especially when people are purchasing it from veterinarian and other livestock sources, it probably is not a safe drug to take at this point.
Well, a lot of people were saying, well, where's the data on ivermectin? Now that clinical trial, we now have a whole bunch of it. All right, Dr. Bill Hartman from UW Health, appreciate your time.
Absolutely, Ben. Thank you.